started. I want to thank you all for being here for the Springfield Medicare for All event, which Springfield Medicare for All is a hub of the Western Mass Medicare for All group here in Western Massachusetts. I want to give a special thank you to some of our co-sponsors of this event. To our co-sponsoring organization, I'd like to thank Arise for Social Justice, Chicopee Democratic City Committee, Hampshire Franklin Central Labor Council, the League of Women Voters of Springfield, Massachusetts Nurses Association, and a special thanks to them as well for printing our flyers, Massachusetts Senior Action Council, Massachusetts Jobs with Justice, Men of Color Health Awareness, which is a MOCA program, Neighbor to Neighbor, Our 413 Revolution, Our Revolution Massachusetts, Out Now, Pioneer Valley Central Labor Council, Pioneer Valley Democratic Socialists of America, Pioneer Valley Workers Center, Progressive Democrats of America, Rise Up Mass, Indivisible Group, and Service Employees International Union Local 1199. We'd also like to thank some of our legislators who co-sponsored this event, City Councilor Ada Gomez, City Councilor Jesse Letterman, City Councilor Catering Walsh, City Council candidate Victor Davila, State Representative Jose Tesado, State Representative Bud Williams, State Representative Aaron Vega, and State Representative Lindsay Sabadosa, State Senator Eric Lesser, and State Senator Joe Comerford. Can we just give a round of applause for all the folks who did that? And joining us in-house for electeds is Mayor Alex Moore. And so I just want to give you a quick background for those of you who don't know about single payer. So in the U.S., we spend more money on healthcare than any other developing country. And we're also the only developed country without universal healthcare. In a single-payer healthcare system, rather than multiple competing health insurance companies, a single public or quasi-public agency takes responsibility for financing healthcare for all residents. That is, everyone has healthcare insurance under one health insurance plan and has access to necessary service, including doctors, hospitals, long-term care, prescription drugs, dentists, and vision care. However, individuals may still choose where they receive their care. It's a lot like Medicare, which is why we have this broad term of Medicare for All. Hence, the U.S. single-payer nickname is Medicare for All. Here in Massachusetts, we have the Act establishing Medicare for All in Massachusetts, and we have a bill both in the House and the Senate, which will guarantee equitable health care across our Commonwealth for our residents. Today, we hope through listening, we learn more about our healthcare system as it stands, and that you leave feeling motivated to support and take action with us in communicating to our communities further about single-payer healthcare system, and also talking to our legislators about the vast inequities in healthcare as they exist now and how single-payer could be a solution to that. A quick outline of today. Where's my timekeeper? Okay. Excellent. Can you sit here because it makes it easier for us? Thank you.
Oh, I can speak for coming here.
Yeah, we're gonna let it go here. So a quick outline for today. We're gonna start with a quick prompt. We have 3 prompt questions. Alicia Fleming here from Jobs with Justice will write down your 1-word or 1-sentence answer to our prompt. And it's just a way to get the juices flowing. If you haven't fully thought about what you're gonna say yet, this might be one of the things that you can talk about from these prompts. We'll then call you up. If you filled out a card to speak, I'll call your name up. And I apologize in advance if I mention someone's name, so forgive me. But we'll call you up and you'll have a total of 5 minutes to speak. Deborah here will hold up a 3-minute warning sign and a 1-minute warning sign, and then Deborah will frantically wave her hands when it's time for you to stop. We are being recorded now by Focus Springfield and for Progressive Democrats of America, so thank you to both of them for being here, for making that available to us later. But if you are coming up to speak and you do not wish to be recorded, please indicate that at the start of your statement, to just say that I would not like to be recorded, so they know to turn off the camera at that time, okay? And If we are unable to reach your testimony at the end of this day, if you have filled out the card, your information is on there, so we'll reach out to you for written testimony. And we hope to have some more events like this in the future, so it's also another opportunity for you to come, bring your friends, etc. So without further ado, we are going to get started with our prompts. And as I mentioned before, these prompts are just one-word answers that we'd like from you, or one-sentence answer. We'll popcorn around the room, so folks feel free to shout out your answer. And so Alicia's going to write down some of those statements that you made during this process. So for the first prompt, in one word or sentence, what comes to mind when you hear healthcare? Thoughts? You sound like you have a thought, Patty, just then.
No, I was at before that word is out. It's only one word, or can I say a sentence?
You can do one word or a sentence.
Healthcare, I say, no, we have health insurance.
Health insurance. No, we have health insurance. We gotta write the whole sentence. Any other words? What over here?
Inequitable.
Inequitable.
Expensive.
Expensive. Two more. Give me two more.
Complicated.
Complicated. Anxiety. I saw a hand over here. I respect the hand.
4 words.
4 words. Go ahead.
Should be human right.
Should be human right. Excellent. Thank you for that. Give Alicia some time.
I spelled it equitable wrong.
It's okay.
We're not counting stuff.
You have one? Sure.
Us against them.
Us against them. Interesting. All right. The next question is, if there's one thing you could change about the healthcare system, what would it be? Now, you just say the solutions to all the things you said. One in the back.
Include dental coverage.
Include dental coverage. That's a great one, actually.
Include everyone.
Include everyone. Yeah.
Include vision.
Include vision. One in the back.
Be able to choose your provider.
Choose your provider. One here. Accessibility. Struggling. What is that?
Medical decisions made by medical professionals.
Medical decisions made by medical professionals.
Is your asset to translation?
Is your asset to, I lost the last part.
Translation.
Translation.
Medication affordability.
Medication affordability. Another one?
Access to substance abuse treatment and behavioral health.
Substance abuse, access to substance abuse treatment and behavioral health.
Doesn't take forever to see a doctor.
And doesn't take forever to see a doctor. Access to substance abuse. Doesn't take forever to get it.
Transportation to healthcare facilities.
Oh, includes transportation and healthcare facilities. That's a good one.
Include long-term care.
Include long-term care. I'll take one more.
But how about remove corporate control?
Remove corporate control. We have a solution for that. Kim, you have one in the back?
Yes, not to, now, if you have pre-existing healthcare problems, sometimes they don't want to take you in there.
So, would it matter if you had a pre-existing condition?
Right, there you go.
And the dreams, extended office hours or
Ah,
access hours.
extended office hours. Oh.
Healthcare over cost, over profit.
Mm-hmm. which is, what's the highest out-of-pocket cost you've ever had to pay for your healthcare? And that can include medication costs. Some of us have had to pay stuff out of pocket because we got dropped from our insurance or couldn't pick up a new insurance plan. I'm just gonna talk about the feelings now. I saw this hand back first.
$60,000 to $80,000.
Oh. It's gonna take a little bit.
I have $300.
$300?
My question actually is, how much did it cost and you refused to pay, or you didn't get it? Or
Yeah.
how much you actually were billed for? Because those are two different numbers in my head.
Yeah.
That's right, yeah.
How much the aspirin costs versus how much the aspirin you get billed for by the hospital, right? That's what
No,
you're saying?
no. How many medical decisions did I choose not to do because I could not afford them?
Oh.
Versus, so you get a ticket price,
Mm-hmm.
and you sometimes just say, never mind, and walk away.
Right. Do you want to talk about an instance? Do you want to tell us an
Actually, I'm
example?
talking too much. I'm gonna shut up now.
Share it with us later.
Okay.
I'm going so far 2,000 for hearing
2,000.
but it's
Ongoing. 2,000 plus.
walking.
2,000.
2,000.
I had a medicine prescribed last year that was $7,000 a year, which I declined.
$7,000 decline. 7,000 minus.
$7,000 annually?
Yeah.
I am going to answer. $5,000 a month
5,000
for a
for
medication that I do not take.
5,000 for a medication that is not being taken. So it looks like every time we've had to pay out of pockets, it's within thousands of dollars. And when you look at that number, you also see that for some of us, that's 2 weeks' pay or your whole month's worth of salary. Certainly far more than anyone working part-time makes a month. So it's very interesting to see. For some of a person that's at 60 to 80,000, that's almost close to what your state legislators make a year annually as a newbie. So think about that. That's someone's whole yearly salary. All right, so without further ado, we're going to get into the main portion of our storytelling piece of this afternoon. Once again, if you have been sitting here and have not already filled out a card, please make sure that you see Jeanette outside if you want to take that opportunity to do that. But without further ado, I'll call up our first storyteller, and it's Chris Quigley, who's going to speak on the topic of treatment. And feel free to come up to the podium.
Hi, my name is Chris Quigley, and I'm from South Hadley. And I was the person who was talking about including dental coverage, and that would be a huge benefit to many people to have feel the artificial split between teeth and the rest of the body, especially for families like mine who have rare dental disorders. I was also the person that said $60,000 to $80,000. My daughter, we brought my daughter to Mass General last week, and that's the estimate that she was given for the reconstruction that she needs in her mouth. And we already, her treatment, including travel, because we had to take her as far afield as North Carolina, has already cost $100,000. And so most of that was out of pocket as well. And so because of this artificial split, the insurers are able to deny treatment for anything to do with the mouth. And so if any of you have dental insurance, you know that that's not going to cover more than $2,000 either. And so what happens to families like ours often is because the teeth are so bad, they basically crumble or wear down to gum level, and then the nerve and pulp pop out. So if you can't afford to get the dental work, it's not like if you have a broken leg and you go to a hospital, they have to treat you. For dental care, you have to have the money up front. And so if you can't afford to do that, what I've seen families do is they crowdfund to get enough money so that they can have all their child's teeth pulled. And that's going to at least stop the infection process. But then what happens is, without the force of the chewing, the bone starts to resorb. And I know at least one person in our online support group whose mid-face has started to collapse because that's what happened to her. So this is definitely medically necessary. There are kids who are in so much pain that they stop eating or they're bedwetting. Obviously, you're not going to have very good job prospects if you don't have any teeth in your mouth. You're going to be bullied and just have all kinds of difficulty with chewing, nutrition, speaking. And so to be able to just know that the treatment that your child needs would be covered by insurance would just be a huge, it would be a huge benefit if we had Medicare for all, just to know that we would be able to get the treatment that our kids need, and that in addition to dealing with the problems of the condition, you would at least have the support of having treatment available. So I would love to see Medicare for all for that reason. Thank you.
Thank you so much for that story, Chris. Our next speaker I'm going to call up is Carmen.
Hi, my name is Carmen Rosado, and I'm representing Stavros Center for Independent Living. We serve around thousands of consumers who are complex disability and also people who are also institutionalized in nursing homes. So having the right health insurance is crucial for everyone. Although we don't have a saying in any politics or anything like that, but we want people who we serve to be able to have access to the community, like having their health insurance in place is essential, especially for people like me. I have a wheelchair, so without the mass health covering for that, I will be without any equipment. So I won't be here if it wasn't for that. But that said, that it takes probably 2 years or more to get a referral. Like you have to go to your doctor, get a referral, get evaluated with all type of thing. You have to say it's a medical necessity, although you are not able to walk. And you have to like basically tell them the whole life of you. Like, so it should not be like that. Because every 5 years I do for a wheelchair. It shouldn't take that long. Because sometimes the chairs break. And if I don't have a chair, I will be home. And the health insurance doesn't cover it. Also, being in the nursing home, coming out of the nursing home, then you have to think, where are my doctors is going to be? Is he going to cover my after health? Is he going to cover like my medication? Is it going to be in the same area that I live? Like a lot of people have to go farther away to see a doctor. And there's no transportation for that also. So it's like you're in a gym when you don't have the right health insurance or your treatment that you need to have in order to survive. Thank you.
And thank you for all the work that you do to advocate for folks with disabilities. Our next speaker will be Shirley, who's going to talk a little bit about cost of healthcare and lapse in coverage.
Such a production just to get up, up here. I'm in my 80s, and I can still remember when my folks were old age, old age, 70s, 80s, whatever. And they had the kind of health care that we want. And I think everybody would feel if you have something and it's taken away, it's worse than if you never had it. And I remember, well, just one specific thing. I haven't seen a dentist in 30 years. And, oh, I'm sorry, I'm doing with the equipment. So, I have corduroy lip, and my dentures are moving around there. There's no anchor. They're just swimming around in there. And I need a dentist. Well, forget it, But I'm thinking back to my mother. She had trouble with her dentures. And one bump would happen or something, and it wasn't a good fit. She didn't get them repaired, she got new. She didn't pay for them because Medicare covered it. And it's us against them. The profit system has gone so crazy that we got Trump in the White House. And they find ways to steal from us, from what was a good system, a great system. But now we have to pay for eyeglasses and teeth and what's the third thing? And ears, yeah. So I'm hoping that this organization, all of us working together, can somehow make inroads into what we used to have. One thing I will say, a couple years ago, I guess, I'm not good on dates or whatever, but I had a health safety net. That was my only supplement to Medicare. And then it was taken away. But now, lately, I've been hanging out at clinics and hospitals, and they tell me that my health safety net is back. It's been restored. I don't know why. Mass Senior Action works hard. They go to the State House, they hang around those hallways, they work hard, and somehow it's been restored. So there's hope on these things. And thank you very much, all of you, for working so hard.
The next person I'd like to call up is Daniel, who's going to speak about the cost of healthcare.
Hi there, everyone. I'm Dan Levy. I'm a local doctor. I started running health centers here in Springfield. And I have one of these complicated messages that I got crammed into 3 minutes, so forgive me if I talk quickly. Why? Reminds me of an old story. Actually, an old story to start off with. When my father, who was a doctor, passed away, when I cleaned out his stuff, what I came across was a paper from his freshman year at the University of Florida in 1930 entitled Socialized Medicine. So this idea has been around for a very long time. And I think one of the key ideas that people have to understand is that failure to put a morally, ethically, and medically appropriate health system in place in the United States for the last 50 years has created this obvious situation which people have talked about. But one of the problems is that healthcare absorbing 18% of the American gross national product, there's a huge number of enterprises which are dependent on healthcare as it currently exists. When Medicare came in, people were deathly, these various interests who are making money in healthcare were deathly afraid of it because they thought it would take our business away, they're going to shut this operation down, and we can't have Medicare. And many people, including lots of doctors who had, at that time, were an especially right-wing bloc, tried to block Medicare. But it didn't happen. Why didn't it happen? It didn't happen because the government was then and remains a wholly owned subsidiary of corporations. That's the problem. We all know the 18% figure as to what percentage of the national budget goes to healthcare. But what most people don't know is that the government pays for 55% of healthcare between Medicare, Medicaid, the VA, Indian Health Service, and a bunch of other programs. There's no place on earth in which a major shareholder owning 55% of a company would allow their principal supporters, meaning us, to be hosed day and night. So I think my single message here is that the problem with Medicare for All is that it only gets the insurers out of the picture. And if you do the numbers, which I don't have time to go into, that's going to save 12 to 14% of healthcare costs. It's a great thing. To look like a European country, we have another 35% to go. And that 35% is achieved by things like changing healthcare staffing so there's adequate primary care. It's obviously changed by things like capping the cost of medications. It's changed by negotiating prices with hospitals and so forth. And that needs the same kind of political guts that we haven't had all this time. So I applaud everyone here. There's not a person in this room who is not fighting for Medicare for all and for better health care. But unfortunately, you can't stop there. You've got to tell your state representatives, I want cheaper drugs, I want them now. I want a better negotiated price, I want it now. Because believe me, Medicare for all can be worked around the way the old Medicare was. It will be worked around. You will not manage to take a 12th of the U.S. economy out of court, but you have to fight for every step of this. It's not going to happen easy. Thanks.
I just want to take a moment to recognize the aide to State Representative Lindsay Sabadosa Laura Britton, who is here. Thank you so much for coming and representing the representative today. We appreciate your presence. Next, we're going to have Jeanette Rivera come up and speak a little bit more about her story about treatment access.
Hi, everyone. I would actually just speak on my everyday existence as an employee in a hospital and the struggle for access that I see for patients and potential patients who call every day. So my employer deals with detox behavioral health, and I get calls, multiple calls, from the same people every hour trying trying to access detox and supportive measures. They are sent to a voicemail, told to call again, wait for a bed, call again, and then if that poor soul has to get to the hospital at a certain time, or they lose that bed, and then they get them again the next day. So I want Medicare for all for these patients, as well as myself and my family. My father just got diagnosed with colon cancer, and his first thought was, can I afford this? And I want anybody's first thought being, can I afford this? And figuring out what doctors would be a part of this plan, and whether or not that's accessible, because his card broke down. And so we're speaking today for those people, and hoping that we can come up with a system that's going to allow for easy access, allow for patients to choose their providers. Distance plays a factor. You need a provider that you trust. You're dealing with your health, your personal issues, and that takes time to develop. And if all of a sudden you change your job, and your new job requires you to find a new primary, that's a new trust that you have to build for the primary. So thank you for listening. That was short and brief. I appreciate you all for being here today. Thank you.
I forgot the names. Next up we'll have our fearless leader, John Weissman. We'll talk about like, fearless, because he has to deal with me and Alicia often.
Thank you, so as a member of this committee that pulled off this event, I had to recruit some people to speak, and they couldn't be here, and I wanted to relay what they would have said. And also, having heard Dr. Levy, I want to reassure you that the Massachusetts version of Medicare for All is going to be the most comprehensive, state-of-the-art insurance plan that you can imagine. It's going to cover everything. The bill has been submitted it's been approved over the years. There's 20 years of work on this bill. And so what we're going to do, we hope in the future, is get you up to speed on the bill itself. If you go to Western Mass Medicare for All's website, just Google Western Mass Medicare for All, you can watch a slideshow which will present the bill itself. And then if you see there's something missing from that bill, we need to hear about it. So one of the things that I learned in trying to find people to talk today is that we need to pay attention to the fact that we suddenly, you need to realize, many people already know this, many of us have multiple insurers. And in the spaces between insurers, of course they're supposed to overlap, sometimes there are cracks. And Audrey McLeod fell through the cracks. She's a new member of Mass Senior Action Council, couldn't be here today. She's a retired city worker in Springfield. She, of course, was covered by the GIC, the Government Insurance Corporation that covers state, county, municipal employees in the state. But she aged out, she went on Medicare, and got a bill for thousands of dollars for a procedure that happened during the period at the end of her retirement, right before her retirement, or right before she turned 65. So what happened is that now we got her trying to negotiate somehow get these two insurance companies, Medicare and GIC, to fix a bill. You can be optimistic that one of them is going to pay, but actually, why is there this stress? Under Medicare for All, there's only one insurance plan. So the other thing is that for unions, healthcare is a battlefield at the bargaining table. And if you follow the Stop and Shop news, you know that right now, the workers at Stop and Shop in New England are struggling with an employer who wants to reduce costs, and in order to do so, has told the Springfield-based local, which covers Western Mass and Vermont, that they want to put their health plan out of business. And they want to force all of their members to go into a health plan in the eastern part of the state. And they want to manipulate the health system in this piecemeal way, only to reduce the cost that they contribute to the health plan, including the cost of running the health plan, because they jointly run the health plans with these unions. And each union has its own health plan, so they want to somehow whittle that down from 5 to 4 to 3. And this kind of bargaining is going to force a strike, where they're constantly trying to get the employees to contribute more, and they want to put successful plans out of business. So pay attention to that struggle. It's just a unique, it's not unique, it's an example now of what's happening in labor movement in general, that we are forcing lower people to go into lower wage status, we're forcing givebacks, we're forcing all kinds of concessions at the bargaining table with the employer is. And the driver of that need to reduce costs is the escalating cost of health care.
Our next speaker is going to be Patty to talk about the topic of being uninsured.
Thanks, everyone. So I had the pleasure of testifying last week for a group of legislators in Western Mass, and the feedback was great because they said they didn't know about some of the stories that their constituents things that they endure in these hospitals right here in Western Mass. And so as a nurse, I'm just going to tell you a few really quick stories that I have, of things I observed only in the past couple of weeks. I'm a new case manager. I work in a hospital here. A case manager figures out what the hell to do with a person who's sick and doesn't have health insurance. And I'll tell you, it's a really hard job. They pay us, they pay for a full team in every hospital to do this. So we're, in addition to billing and all those other things, they have people like me who have to navigate these systems and find out where people are going to go. So one thing that I think was really important for people to learn was that when you're a veteran and you have VA insurance, you can go to the VA for years, and you have a doctor, and you have your high blood pressure managed, you get your medicines. But when you're really, really sick, and you're an older veteran, and you go in the hospital, VA sends you over there, sometimes you can't get the care you need because the VA won't pay for it. But you can't switch over to Medicare, even though you're covered by Medicare. And that was something I found out that I have had patients who I had to tell them, you have to waive your VA insurance that just paid for the last 3 days in the hospital, pay that bill. Then Medicare will pick up your future health care. So what do? They go without, even though they're insured by two silos of health insurance, in the nation. The other thing that I see often, and this story really illustrates what so many of our folks face. Patient came into my hospital, covered by Health New England. Employer only gives one option, Health New England. Young man, he has a condition that's kind of unusual and not easily managed in any hospital. He has a big blood clot in his neck, in one of his blood vessels. So they don't really know why it's there. Health New England will only send him to Bay State Medical Center. So we argued with Health New England and said he needs a special neurovascular surgeon. They didn't have any beds in their neurovascular area of the hospital. We had space at Mass General. Mass General would take him. Bay State won't pay for Mass General because it's a competitor. So he couldn't go there. So he languished in the hospital for 3 days while this clot was chipping away at his brain. And finally, Leahy Clinic was given as an option by Health New England, but Leahy didn't have beds. So for 3 days, there were no beds in the hospitals his insurance would pay for. This is just a month ago. And then after the weekend, there was a bed at Bay State, and that's where he went. But some of the damage was already done. And I don't know what happened to him. But that kind of thing happens all the time. That's an insured person, an employed person who has a family to help him, but he couldn't get basic health care that he needed. And then I've had patients who have had medicines for their pneumonia, which were so expensive that their insurer wouldn't pay for it. So they would pay for it in the hospital, but when they went home, it was cheap to administer this medicine. The better, they go home. The insurer would pay for the antibiotic that the doctor wanted the patient to have, wouldn't pay for that antibiotic at home. So the patient, the sick patient, had to catch a bus every day to the hospital to have it infused in the hospital. The system doesn't make sense. And this is I could tell you 1,000 stories. I only have a minute left, but every single day I see this, and those are the people who have insurances, and then there are the people who are uninsured, who just don't even make it in the door.
Feel fired up now. Like, please, tell another story. Next we'll have Victor Davila.
Good afternoon, everybody. Thank you, Chanique. My name is Victor Davila. I'm a resident here at Springfield, and I'm excited to see so many wonderful faces here during this important rally of Medicare for all. So I was thinking as to what to start saying today. I kept thinking of a video that I saw yesterday on Facebook. And it was basically a single family with a child who was sitting in a restaurant, and they couldn't eat because they had no money. So there was a single father and a child sitting there while everybody was eating and grabbing a bite. It wasn't until the kindness of the young lady that came up and offered the father to buy dinner for the father and the child. And what really touched me was to see the child happy. Because in the video he was jumping happy that he was going to get to eat. I tell you that because it really did bother me. And that's exactly how I see the healthcare industry in this country. It's not the calling industry because everything boils down to the money. That's it. I myself own a small transportation company. And I can tell you from first account that transportation here is critical. We cover the way from Greater Springfield, from Long Meadow to Holyoke, West Springfield, Chicopee. And the amount of people that rely on transportation on us is incredible. And we need to make sure that we have transportation accessible for everybody, because not all health insurance do cover transportation. And that's a critical point. How are people going to get to their appointments if they don't have transportation? I made a comment about translation. I can't even tell you how many people on a daily basis tell me, can you translate for me? Now, I take it upon myself at times to go in and translate, but I can't do that all the time. You go into places and they have no translations whatsoever, services available. And these are people that rely. And people tell me I'm upset because either I called, nobody's here, what am I going to do, Victor? I can't talk to the doctor. And these are people with serious conditions. Now, kind of my own personal story, myself, I got into the health connector. And I was so excited that I got into the health connector. You know how much they wanted me? They wanted me to pay a month? $1,020. And I'm like, how the heck is this supposed to be accessible?
Right.
Well, you make too much money. I'm like, but don't you make too much money? So could you define too much money? I can't pay you $1,020. I went a whole year without health insurance. Then finally, over the way, I have high blood pressure. So I went a whole year without my medication. I just couldn't afford it. I went to get it. I even got the prescription, the RX, and it was just too expensive for me. Then I finally got into a talk, and it was just a nightmare. I couldn't cover anything. My wife needed to go to the hospital to do a couple of medical procedures. It was just really rough. But the most important thing, my own mother, the breadwinner of my family. She's 71 years old. My mother is a breast cancer survivor twice. She's a real diabetic. And so the doctor said to her, you have to have a pacemaker put in. My mother worked all her life. She retired. She was in Health New England. She carried that over after her retirement. Then, one day, magically, out of the blue, they dropped my mother from health insurance because, according to them, she had missed $179 payment. So my mother has been, for the last 2 years, unable to get the pacemaker put in because of $179. That's a crime. And she's not able, she didn't have a last spell, so she had to apply for that, but it's just been a nightmare one way or the other. So you mean to tell me that because of $179, my mother cannot have a pacemaker put in? No, that's not acceptable. And that's why I'm here. For my mother, and for many other mothers. For all the people that need translations, all the people that need transportation. Because if you work hard, if you're a human being, you do deserve health care. Thank you, and God bless.
I don't think Victor is running for city council. Everything about that sounded like a really good setup for a speech. Like start with a story, tie the story in with a personal story. As an organizer, I appreciated everything about that. Next, we're going to have Alicia Fleming come up and speak.
My name is Alicia Fleming. I'm an organizer with Massachusetts Justice Justice. I'm also a single mom. And about 7.5 years ago, give or take, I found myself pregnant. And a little while after that, I found out it was a high-risk pregnancy. And a little while after that, I found out I couldn't work anymore. And in that time, between when I found out I was pregnant and when my son came, I fought tooth and nail every day for equitable coverage from a provider that would listen to me and believe me about the concerns I had for my son. My son had in utero a condition called single umbilical artery, and what that means is his umbilical cord had one artery instead of two, and that affects birth weight, but also is indicative of a number of other genetic problems, some of which could indicate that my child would be born and die soon thereafter. I went for genetic testing to see if we could find some genetic markers that would give us more of an idea of what we were dealing with when I was around 5 months pregnant. And took Mass Health Transportation to go back and get those test results. Mass Health Transportation sounds great, but it can be incredibly difficult to arrange. Got all the way to the doctor, and the provider didn't know that I was there for my test results. It wasn't my regular provider, and so I was irate and upset, and they threatened to drop me. And so I left that provider in the middle of my pregnancy, my high-risk pregnancy, and went to another provider. And the coverage and the treatment was pretty good for the most part. I had to take transportation twice a week to go in because it was a high-risk pregnancy, so I was going in twice a week for pretty much the duration of my pregnancy. Until childbirth came around, until I was in labor. I was in labor for 36 glorious hours. And when I went to the hospital about 8 hours in, they evaluated me in what they call B2, which is basically the emergency room for pregnant women. And because I wasn't progressing quickly enough, they said, well, why don't you go and take a walk? That sometimes helps. And I was alone. I had to call somebody for a ride to bring me to the hospital while I was in labor, and that person had to go to work. So the provider sent me in labor, it was probably my 9th hour, to walk around the hospital by myself. It was a high-risk pregnancy. So knowing that I wasn't going to be able to eat or drink or anything forever, I stopped in the cafeteria and got myself a coffee. And the provider, I bumped into my doctor, who was a fellow, I believe, or maybe a resident, and she said, oh, you're drinking coffee and you're walking, so you're probably not really in labor, so I'm going to go back and I'm going to discharge you. And she did an ultrasound, after she had already done the discharge papers and everything. And thank God she did that ultrasound, because what she found was that I had no amniotic fluid. And it's incredibly dangerous. And so, of course, then she was very scared that she had made that mistake. And despite my telling everybody that something wasn't right and that something was wrong and that I was in labor, they were going to send me home. So if it wasn't for just that one ultrasound, things could have gone terribly wrong. And the beautiful 6.5-year-old that so many of you know and love maybe wouldn't be here today. And so when I think about what Medicare for All would provide, for me as a woman of color and as a single mother, it would provide not only a peace of mind, but also the ability to choose a provider that would believe you. And I don't know how many people are aware, but we're seeing an increasing number of stories in the news, specifically from women of color, with regard to not being believed by their providers when it comes to childbirth. There's so many women are dying and so many babies are dying, and just being able to choose a provider that you trust when you're in that important moment would mean so much. But I was limited to just 2 choices, and neither of them were adequate. And I know that so many other women who have more money and paler skin maybe have more choices. And I think that we all deserve that. And so from that personal perspective, I'm a huge supporter of Medicare for All, and really will do pretty much anything to get people active about this movement and involved in this movement, and to bring this to the communities that need it so badly. So thank you.
Next up, we'll have Ernesto Cruz, who's going to talk a little bit more about treatment access.
Thank you, Shanique. Let's see, where do I start? Really, I want to talk a story about my stepfather who passed away not too long ago from vascular dementia, and just the fact that he didn't pass away only because of that. It was dementia, the complications that sprung from it, and it changed my life perspective forever in terms of thinking about healthcare and what it means to provide healthcare and what's the reason behind it. So right now it's a corporate mindset that runs healthcare. Corporations see you as a number. They see you as someone who affects their bottom line at the end of the day. So every decision that was made in the healthcare system, seeing as this is someone we care about, we're looking at it from a different side. So when they're saying, we want to get him back home, he had some kind of episode with his heart, they want to, keep watching him. Now he's in a nursing home, and when he's in there, he can't speak anymore. He can't vouch for himself. Most of the communication is nonverbal and from people who know him best, and people live longer when they're at home during circumstances like this. And, because of issues with liability, because of issues with when that happens, we do this, they kept him for far too long. Had we had him home earlier, I believe he could have lasted maybe a year more, and not just that, but with a higher quality of life. And it's just important to recognize that these corporations, these industries, and these insurance companies, they're not going to all of a sudden become more compassionate, because that's not what a corporation does. They're not going to care about us because that's not what they do. What we need to have is a system that works for the sake of healing people, a system that works for the value of life rather than the value of the dollar. And that's not going to change until we get together and we make that change happen. Because none of your family members are a statistic. They're not a number. They're not something to have on a report at the end of the year. They're human beings. And so that's something we can all share. And I think that's something that we need to remember every time that we're advocating for Medicare for All, is that this is here for us, for people, for human beings, and that's what we should have on the forefront. Thank you.
That was the last part that not fill out a card that might want to speak? And Laura, you want to speak after? Yes. Thank you. I thought that was going to be a lot harder, but I guess.
Hi, everybody. I'm Nancy Stenberg. 2 years ago, at the very young age of 55, I was forced into retirement from my job as a public school librarian. And the biggest effect that had on me was that I was not allowed to take the health care from the school system. So I entered the joyous world of mass health. And, you know, sometimes I do have jobs and then I get that health care, but then in between those jobs, I have to go back on mass health. And this time, it took me 6 weeks to get back onto mass health because I had the temerity to have a pension from, you know, being retired, so they had to think about that. And because I have a pension, I have to have the health connector. So, you know, I don't really have mass health, I have the health connector, which means I have to do something weird with my taxes, so I can't wait to do my taxes. Also, I'm sure I'll get slapped with a fine for being, you know, uninsured for 6 weeks. After I finally got back on, I had to change inhalers because they determined that I was not worthy of having a name brand inhaler. So when I went to call Mass Health to say I had to have a new inhaler because I only knew the name of my inhaler and not the scientific name of it, the guy, Sam, I was talking to got pissed at me and hung up on me. Okay, so that was one thing. Then I had to find I had to change the providers of my CPAP supplies, but my, you know, my health, what are we calling it? We don't have health care, we have what?
Health insurance.
Health insurance. So my provider didn't have a copy of my sleep report, so it took me a month to track that down. So now I'm like way overdue on my CPAP supply, so I'm not sleeping very well. Oh, and in that time, I got so stressed out, my cholesterol went up 40 points, so now I'm on a cholesterol drug. So that's my experience on mass health over since, you know, in the last 6 months. So I really, really would like to see us have Medicare for all. Thank you.
Next, we'll have Laura Britton, and then I'll have Kim Rivera.
Hi everyone, my name is Laura Britton. I am legislative aide for State Representative Lindsay Santosa, who is the lead sponsor on Medicare for All Massachusetts. And thank you for organizing this event to me. Thank you, Alicia, Deborah. Saw you yesterday. And I just wanted to give you some quick information. Tuesday, the 19th, this past Tuesday, was the inaugural meeting of the Medicare for All Caucus. It is co-chaired by Lindsay Santosa, Tammy Govea, who's a state rep from East, Senator James Eldridge, and Senator Joe Comerford, who might be your senator out here. And I just want to let you know that there are legislators who have this not just on their radar, but as their #1 priority. But I'm seeing a lot of familiar faces in this room, and I just want you to continue to get the word out so that we can get some new people on board. We're going to be having some information sessions. Lindsay just yesterday did an informational video with Deborah, and we're hoping to get that up on Facebook as soon as possible. That way we can get the word out so that we can, you know, get some more people involved, because that's really important. And please continue to reach out to your legislators if you need information. Western Mass Medicare for All is a great resource, but reach out to your legislators, let them know that you're on board with this, this is your priority, and reach out to Lindsay if you need any talking points. Thank you.
And Kim? Hello, Kim. told just now, so that's how that happened.
Hello, everyone. Thank you for being here, and thank you for having me. One of the things that I feel that we struggle with is when people seem to get raises and end up in a different income, they have less access to good quality care, health care, and I believe that that's something that we should make sure that doesn't happen. You know, because of course we all want to make sure we get our pay rate according to the quality. Oh my God, I forgot what I want to say. We want to make sure that we get paid well, but we want to make sure we also have access to health care. And just because I get a raise, I want to be able not to get a health check or not be able to pay my prescriptions. I want to make sure that we have health care for everyone. Thank you.
I'd like to call up Mayor Morris. Say a few words.
Good afternoon, everyone. First of all, thank you for allowing me in the Springfield City Hall this afternoon. I'm Alex Morris, I'm the mayor of the city of Holyoke, and happy to be here with all of you this afternoon. Primarily just to listen to most of your stories, and I think it's unfortunate that I think all of us have a similar story in common about ourselves or our family members. And when you were speaking in particular about working at a detox center with folks, calling by the hour, I've had multiple immediate family members that I've been either calling on their behalf or sitting next to them on the couch or in the car as they make those phone calls. You're told to call back every 45 minutes in the hopes that there's a bed. Oftentimes you're told that they're not, and so maybe you want to call a few places in Worcester or in the Boston area or out of state. And I recall one time in particular, we finally got a bed for my brother Doug in Worcester, and we had talked about health insurance, and we finally saw some light at the end of the tunnel. And mind you, this was not the first time that we've been at detox, and if anyone knows anyone that struggled with substance abuse, sometimes the 5th, 10th, 25th time that you see some progress in detox and other programs. And so we got in the car and headed out to Worcester, and we went through the process and had to get patted down by security. So number one, you're treated like you're less than the minute you walk in. And then number two, I'm about to leave, and then the woman at the other side of the glass starts to shuffle around the paperwork and says, hold up, actually, if health insurance isn't accepted here at this place. And so after driving nearly an hour to Worcester, walking around the neighborhood, finally finding a place, getting treated like a second-class citizen, you're being told that, again, your health insurance isn't accepted here. And I mentioned before the importance of health insurance covering folks with mental health, substance abuse addiction, because those are things that I have interacted with most closely with my family members. And I've also watched my mom when she was alive. And unfortunately, she passed at the young age of 56 last year, suffered with different types of mental health issues. And the number of times we had to decide that she couldn't afford to go to this expensive inpatient unit or retreat or whatnot further perpetuates the class divisions in our community, where those who have means can afford great treatment and those who don't are stuck with what they have access to. And so it's not just those personal interactions, but the interactions with people I've had over the last 8 years as mayor. People have literally come in the office to talk about their GoFundMe pages to pay for cancer treatment, to pay for a broken ankle. And those are things when you as mayor, as an elected official, don't have the authority or resources to be able to make a difference in people's lives as they come to your office. It's a system much bigger than City Hall, it's a system much bigger than all of us in this room. And I feel we're lacking both state and federal leadership on this end. And so I really appreciate all of your efforts in this regard, because I, as mayor of the city of Holyoke, support Medicare for All. I reached out to the representative, Lindsay Sabadosa, and it's my intention over the next few weeks to engage with my colleagues, mayors around the state of Massachusetts, the launch of Massachusetts Mayors for Medicare for All. Initiative to really put the pressure on our state reps and our state senators. I think for too often we make this tiny incremental progress on the state level that isn't bold or progressive enough, and it's really great to see some of the freshman members of both the House and the Senate really be the bold progressive leaders that I think we've been waiting for. We've also seen Congresswoman Jai Paul's Medicare for All bill on the national level. We have now seen mayors and city councilors pass resolutions in support. And so I'm hopeful we'll have that conversation in the city of Holyoke as well. But anything I can do as mayor of the city of Holyoke over the next few months to elevate this conversation and talk about local stories we have in our community, certainly want to have that conversation. And on the actual practical side, as the executive of the city of Holyoke, we have to negotiate with health insurance companies year after year. And so we can bring new economic development to the city. We can cut basic services for residents. But when we're looking at a 10 to 20% premium increase just for the employer portion of health insurance, $1 to $1.5 million a year, we can only tax our residents so much. We can only shift the burden to our employees so much. And again, it's another example of operating with a system that's broken, that's corrupt, and that's driven by corporate profits and pharmaceutical costs for the employees in our community. So I've seen it firsthand in many different ways, and I'm just more energized by hearing the stories of all of you this afternoon. So thank you again for allowing me to say a few words, and I look forward to working together with all of you to get this job done. Thank you.
Was there any other individuals in the room that wanted to make any statements, thoughts? Anyone? Yes!
Hi, I'm John Berkowitz. I live in Northampton. And I just wanted to add that this is Medicare for all for, Massachusetts, but this is a national problem and a national issue. And I just want to make a connection coming here. I realized last year I was involved with the Poor People's Campaign, the new Poor People's Campaign. And there was an action in Springfield, and I was happy enough with 23 others and looking around the room to see if anybody was there. 23 people got arrested at the federal building for calling for economic justice, and part of that is healthcare justice. So I just learned that the Poor People's Campaign under Dr. Reverend William Barber and what's her name, Liz Theo Harris, they're organizing a large gathering in Washington, D.C. In June to try to bring economic justice and healthcare justice right into the campaign for 2020. It was kind of quiet, like other issues like climate change and other important issues in 2016. Let's not have it be that way in 2020. And the last thing I want to say is, one piece of the healthcare picture that I'm involved in, I've got information over here, I'll just keep it to 30 more seconds, is called, I'm the director of an organization called Western Massachusetts Death with Dignity. And it's about, should there be a human right if you are really sick, I mean terminally ill, and able to make your own healthcare decisions, so that you should be able to go to a doctor. This is the way it is in 7 other states, Washington, D.C., and Maryland House of Representatives just passed this also, so that could become the 8th state. To be able to go to a doctor and say, I want a quality of life, I want a dignity of life. I have 2 days, 2 weeks, 2 months to live with a really difficult and painful disease that perhaps the best of hospice care, the best of palliative care, which is really good, but it's not perfect, and all too often there's difficult deaths. So we're trying to get the law passed in Massachusetts, just like these other states, and many other states are proposing it, New York, Connecticut, Rhode Island. So it's something I feel really strongly about, that I would like that option. I would like it for loved ones, friends, people that I know, and that's why there's a movement for it all over the country. So if you'd like more information after this is over, I've got it. Thanks.
So I wanted to take a few moments to just touch on a couple things, but as I was listening to folks share their stories, it made me want to speak a little bit about myself and my family's medical history, as you would say. I really resonated with what Victor was saying about translation being needed, because I think most of you may or may not know this about me, but I'm originally from Kingston, Jamaica. I immigrated to this country when I was 7 years old, and I've lived in the city of Springfield since. I spent some time away when I was in college, but for those of us who are from other countries, for those of us who have accents, for those of us who have learned how to drop an accent in order to fit in, healthcare is one of those places that has issues in its own about systemic racism. And I think some of what Alicia was talking about in her own story was this racism is built so much in the institutions of America. That is a fact. Anyone wants to fight me on that fact, I have history for you. But what Medicare for All means to people of color is that there is nothing that's going to prevent me from receiving the care that I need. It won't matter if I have an accent, if I'm not from this country, where I live at, am I a permanent resident or not, that I will be sick and get care. And for those of us who know what it's like to be dropped from health insurance plans, for folks like my mother, who is an intelligent woman, who has 2 degrees, who used to be a teacher in Jamaica, and was a business owner for 15 years in this community, and struggles with diabetes. And last year, my mother went 4 months without insurance and having to pay for her medications, both her blood pressure medication and her diabetes medication from out of pocket. And the reason that happened is because, you know, Mass Health has its own rate, or the health connector, however you want to call it, but there's a period in which you can apply. And so if you miss that period, or you got dropped from Mass Health and you now need to get on the health connector, if you miss any of that, or in this case what happened was a clerical issue, they were sending notices to my mother to not the right address. So she was not receiving information that she needed to submit certain documentation in order to continue, because that's another thing that they ask you to do. You're going to have to submit things in order to prove that you need health care or whatever administrative things need to be done in order for you to remain on health insurance plan. Because she missed letters that was sent to the wrong place, she no longer had insurance for several months. And you have to wait the several months in order to get back on plan because you missed the open enrollment. And during that point, she kept trying to advocate for herself, trying to talk on the phone, waiting on the many different lines and talking to the many different people, trying to understand why is it that I don't have health care. Until one day my mother says to me, "Can you just call with your American accent?" And I can't tell you how many times I've had to use my American accent just to get my parents access to things. And it's upsetting when your mother has to apologize to you for yet again asking you to take time off of work to help her with something she's quite capable of doing on her own. So I go to the Mass Health office and I sit down with her for a half hour waiting to speak to someone. And with my American accent, explain that we do not understand why my mother has been uninsured for 4 months. And that is how we discovered there's been a clerical issue. There has been paperwork sent to her that she did not fill out because it was being sent to the wrong address. How many weeks and months has my mother been on the phone? And I sat down in an office for 10 minutes for them to figure out that that was the issue and give her insurance. She was able to enroll. They made some magic happen, and she was able to enroll. But that was months of her trying to find payments to pay for her medication, not taking her blood pressure medication at all, because then you start to prioritize. What will help me live? And my diabetes medication will help me live, and I'll just go without my blood pressure medication because I can't afford both of them. So that her daughter can come in for 10 minutes with American Access and ask the same question, why am I been dropped from my plan, for someone to find an answer. And that's unacceptable that that happens to so many people, that it happens to seniors. We've heard a number of stories like this. We've heard about dental care needing to be included in these care. And with single payer health care, you will have dental coverage. You will not be looking for providers. We've heard folks talk about being able to choose your provider. In many of my mother's stories, especially with her diabetes, just the other day she said to me, "I really hate the doctor that I'm at right now. They won't give me the medication that I prefer. I really wish I could still go to that provider in Ludlow because it took such good care of me. But because now she's on the health connector, what she has is not the insurance that they cover there. So she's no longer getting the great care that she needs. And she will yet again go on the hunt of finding a provider who will listen and believe her and will give her the care that seniors need at a time that they need it." As seniors age, Cheryl talked a lot about this, that as you're aging, there's a number of things that you need dental care. You'll need hearing aids perhaps, and not being able to have all of what you need to have a good quality of life is so disrespectful to our seniors, to our veterans, to the people who have come before us and given us so much. And we hope that folks continue to share their powerful stories. We hope that this event has given you the motivation to feel inspired to not only talk to your legislators, to get involved. So the Springfield Medicare for All hub is a hub of the Western Mass Medicare for All group, and we're hoping to have more hubs like this. So if you are not from the city of Springfield and you feel fired up to get a hub started in your own community, we encourage you to do that. Our hub is meeting the fourth Friday of every month at 5:30 at the AFL-CIO building on Page Boulevard. We encourage you to sign up to volunteer or just to sign up on our clipboard. So if you have not, when you came in, signed up, make sure you sign up to at least get information about when we're doing things, how we want you to get active. But of course, sign up to volunteer. Volunteer means that you come, sit around with us. We're always a good time on Friday night. As John will say that we digress a lot, but I think it's a very therapeutic thing. So we encourage you to join us to help us do more events like this in the community. As Laura, the A2 Lindsay Sabadosa had said, that what we need is more people talking about this. What we need is more people educating each other about this. And I think that's true for all things, but I think this is one of those things we can all agree on. Like, we should have quality healthcare. Healthcare should not be a business, as John was talking about, where we have unions bargaining. How do you bargain healthcare? How do you bargain people's health or what their health will be like 5 months from now or 6 months from now? Some of us live totally healthy lives and something tragic happens and you need more coverage and more care and you have to be worried about money at that moment is unbelievable. The fact that a mayor, who is an amazing mayor, has family members that he has to travel across the state to supposedly get the care that his family needs, to then be denied that care because they don't have coverage. And it shows that it doesn't matter at what level or how much money you make in this country or in this community or in this state, it does not matter. We all face barriers and inequities to healthcare. And so I encourage you to feel inspired to get up and talk to individuals in your own family, even the folks on Mass Health living their best lives right now, that Mass Health isn't that great. We need single payer and we need it now. And so before we close out, I'd like to give Alicia a moment to come up and say a few words on behalf of Jobs with Justice.